CBS 2 Health Alerts. Save your life, but possibly harm your heart. Important information tonight about the connection between breast cancer and heart disease.
Turns out some breast cancer treatments can damage the heart. CBS 2's Dr. Max Gomez tells us what you can do to protect yourself.
You know, most women fear breast cancer more than any other health problem. But in fact, heart disease is by far the #1 killer of women. So what should women do when they hear that radiation and some chemotherapy is toxic to heart cells? Just as Tonda Gansa won her fight against breast cancer, she quickly found out there was a whole new battle in front of her.
It turns out that the main artery, the main one that you do not come back from, was 99% blocked.
Tonda needed a stent to open her blocked artery, which was likely caused by her cancer treatment. Complications like these aren't uncommon. In fact, older breast cancer patients more often die of heart disease than the cancer itself. Which is why the American Heart Association published the first scientific statement about these two major threats to women's health. Dr. Lakshmi Mehta of the Ohio State University Wexner Medical Center was the primary author. She says oncologists and cardiologists need to work together closely to give patients the best chance against both diseases.
The statement really is there to provide a concise document for the medical community on the overlap between heart disease and breast cancer in terms of risk factors, in terms of the treatment and preventative therapies.
The Heart Association wants to make sure that both doctors and patients are aware of the cancer treatment heart disease connection, so that they are extra vigilant for warning signs of cardiovascular problems. One way to minimize heart and lung damage from breast radiation is to have what's called prone breast radiation, where the breast is allowed to fall away from the chest so the radiation doesn't go through the chest. And of course, lifestyle changes can help prevent both diseases.
Being active or exercising can actually help in the outcomes of both disease processes. Eating a healthy diet is imperative for both. Healthy weight is important.
Now, there are some alternative chemo regimens and protective medications to minimize heart damage, but the most important message here is that breast cancer survivors should be followed closely by a cardiologist who knows what medications and radiation their patient had for their breast cancer. That way, they'll both live a long life.
You bet.
From both diseases.
All right. Thank you, doctor.
You bet.